So beating heart is always fine because we know that our heart is beating and we are fine. But if your heart beats very fast and it is sudden, that may indicate some problem. So I will be speaking on it. I am Dr. Suchit Majumder. I am attached to Apollo Multispeciality Hospital, Kolkata as a consultant electrophysiologist and interventional cardiologist. So the problem is that some of you might feel that your heartbeat suddenly races out of the blue. You don't want that time it races suddenly. So your heartbeat can race when you are racing, means you are exercising. That is usual. But if it is racing without your consent, means suddenly it races, that is a problem. So that we call as arrhythmia, and there are some reasons for arrhythmia, means there are some short circuits in the heart or some extra connections in the heart that can result in it. The good thing about is that many of these extra heartbeats or fast heartbeats are curable if properly treated. So if you are having any of this problem, get it documented by an ECG from the nearest hospital or nearest clinic, show it to a doctor who may be a cardiologist and electrophysiologist, so that he understands why your problem is there, and accordingly he may give you an appointment to an electrophysiologist who will evaluate you by an electrophysiology study and treat your abnormal circuit, so you can have a problem-free life, so that you are not bothered by these palpitations later on. Heart beating is fine because we know we are alive, but if your heart is beating very fast and suddenly, it may indicate some problem. Now you can have a very high heartbeat when you are running or you are having a high fever also. Those things can be normal. But apart from any other cause, if you have suddenly very fast heartbeat and it occurs in episodes, maybe the frequency of the episode is less initially and then it increases. That is something abnormal. This problem is most often due to some abnormal connections in the heart, and which are mostly related to your upper chambers of the heart. This is called as a supraventricular tachycardia. Sometimes also this can be due to your lower chambers of the heart. We call it as a ventricular tachycardia. So whenever you have this sudden increase of heartbeat, it is best to do an ECG by a nearest doctor or nearest clinic, so that you record what is happening in your heart. And then you can consult your doctor, who by seeing your ECG will refer you to an electrophysiologist who will evaluate you by an electrophysiology study to find out the cause of increased heartbeat. Many of this increased heartbeat is due to abnormal connection, which can be treated by electrophysiology study and radiofrequency ablation. This problem can arise at any age. It can arise in adolescent people as well as adult as well as elderly people. So this influences your quality of life, your office, your school, everything. So for this you need to get treatment because it is curable in more than 95% of the cases. And after that you can discontinue your medicines. So if you have this problem, do immediately consult your doctor and get their advice. Thank you.